Chris Perry. I'm the current president of the AMA in Queensland, and I'm here to represent the AMA in Queensland to support the reforming of palliative care within our state. We know it's chronically underfunded, all the way from paediatrics to geriatrics. Currently, palliative care is better in some postcodes than others, which is just completely unfair, especially to rural people in provincial cities, but also postcodes within Brisbane itself. We know this because there's been an inquiry into palliative care, aged care and end of life. Reports have come out, and there's also been a Royal Commission into aged care with unhappy and poor results throughout the country, but also here in Queensland. We're seeking more than $270 million to try and address this issue. This is a combined effort of the AMA in Queensland with our partners, Palliative Care Queensland, and the Queensland Specialists in Palliative Care, the Clinical Directors Group, who are the leaders of the palliative care services within Queensland. So this is not a small fly-by-night group. We are in league, in cooperation with the real palliative care delivering people within Queensland. It's what's needed for the best practice. It's what's needed to catch up with other jurisdictions who have similar sums of money being spent on palliative care in their states. There's an election coming, and it's important that our political parties tell us what they're going to do about this. They've had plenty of time to put things together. It's a very delicate time in Queensland, especially with palliative care. There's lots of discussions about end of life decisions, and most people would be satisfied that good quality palliative care is what they want for themselves and for their families and their relatives. Good palliative care makes it easy for people in their last months of life. That's what it's all about. Good, well-funded palliative care is what Queensland needs, and in this election period we call on the major parties in Queensland to tell us what they will do for the most disadvantaged and potentially dying people within our community, from children to elderly adults. Thank you very much.